Hey there, Dr. Craig Hazel here from Synergy Chiropractic, a creating wellness center in Canada, Ontario, Canada. Today I want to talk to you about hips, specifically hip mobility. One of the things that we find is that if the hips aren't moving properly, it can put a tremendous amount of stress into the low back. Specifically, what happens is 85% of employees sit at a desk all day. That passive amount of force going into the hips causes adhesions in the joint capsule, it causes tightening and tension within the musculature, and eventually it can start to lead to rigidity within the spine. What that can translate into is, again, things like low back pain, disc problems, degenerative disc disease, osteoarthritis of the spine. All of those things are just the byproduct of a cause, and the effect is all of those ailments. So what we want to do is we want to get those hips moving properly. So in this video, I'm going to show you a series of things that you can do as part of your regular routine to get your hips moving. It is by no means exhaustive. If you have questions, feel free to ask your healthcare practitioner or post your comment below. Here we go. All right, so the first thing that we're going to do is we want to address some of the musculature. And for the sake of posterity of time, what I want you to do is educate yourself on where the muscles of the hips are. Predominantly, what we have is the glute max, glute medius, glute minimus, as well as the piriformis. We have a whole bunch of internal and external rotators deep within the hip. Really, the only rules of this first part is if it feels sketchy, it is sketchy. So stop right away. What I mean by that is the first thing that we want to do is we want to get those tissues freed up and moving and gliding. So again, with a foam roll, with a yoga tune-up ball, or a lacrosse ball, what you can do is you can start to work on some of that mobility by getting some of those tissues freed up. So just with the ball underneath your hip, again, you can start to tack and floss and get some of those muscles unglued, if you will. It's almost like having your own massage therapist to try and work on some of those muscles. You can gain leverage by either holding yourself up, letting yourself come down onto the ball more. If you can't hold yourself up, then what I would recommend is doing it up against the wall. You can place the ball against the wall, and then you can start to lean into the ball that way. You can put your leg over, and again, you can start to pull those muscles apart. Find a little knot. When you find one, you can contract the muscle, you can relax, you can go north and south, east and west. Try and get those muscles unglued. For great resources on that, Jill Miller from Yoga Tune-Up Therapy has some amazing stuff. Mobility WOD, awesome websites. Go check it out. What I want to focus on is some of the mobility things. Specifically, what we're going to start with is the Grok squat. And what this is you're simply just going to get down into this low position. Now, this is not an easy thing to do. If you find this hard, you can slide a yoga block, a couple of yoga blocks, maybe 3 or 4 yoga blocks. But essentially what you want to do is get your toes pointed forward. You want to get down into this low position with your knees just barely outside of your hips. You'll see that the natural arches in your feet start to lift when you get into this ideal position. You're keeping your torso and your back flat. And essentially what you're going to do is you're going to stay in this Grok squat position, all the while stretching out the inside of your thighs, your groin, your hamstrings, getting the quadriceps to stretch even. This is position 1. Position 2, we're going to go into what we call hip internal and external rotations. So getting your feet into a situation where you've got a 90-degree angle in your lower leg and a 90-degree angle in your upper. And essentially you're going to go like a windshield washer, 8 to 10 times per side, all the while keeping your torso nice and tall. You don't want to collapse forward. You want to keep nice and tall, keep that stability within your lumbar spine. Okay, so those would be your internal and external rotators. The next one that we're going to do is we're going to start to focus on getting the hamstrings moving. So laying on your back, if you need to, you can use a yoga strap, or what I like to do is I just like to hold on to my foot. I want to keep my lower leg down against the ground as much as I can. And I'm just going to try and pump into that position, stretching my hamstrings. If you find this really difficult, again, you can hold a towel or a yoga strap, and essentially you're just going to go into the corners. You might want to externally rotate your foot, you may want to internally rotate your foot, and you're just going to work on getting those hamstring muscles to unglue and start to get them to work. Another option is you can hold your knee and you can just rhythmically pump, straightening out your leg, okay? Now, if you're getting any nerve tension with that, you can refer to some of our other videos that talk about how to free up those neurodynamics within the hip. The next one that we're going to do is simply what we call the pigeon pose. Again, classic yoga pose, just getting into that ideal position. Ultimately, we want to work to getting to the point where that shin is almost perpendicular to the spine. My back leg is straight and parallel with the spine. It's just an extension of it. I don't want to be way out here. I don't want to be bent back this way. I want to keep nice and straight, and I'm simply just going to lower myself down, working on stretching those hips. What I can also do is I can kick it up a notch by trying to suspend myself out over top of my leg. As you get stronger with this, this can be a very, very good strengthening exercise for working through the entire range of motion, okay? The other one you can do is you can get into that 90-90 position again, and the same thing is you can come out, work on strengthening through that full range of motion, okay? And you can even go back to the side, trying to keep my knees down the whole time. Again, I'm trying to keep my torso as tall as I can. I'm trying to reach forward with my chest versus bending and trying to flex my lumbar spine. All right, so the next stretch that we're going to do is called the couch stretch. Again, classically, Kelly Stark from Mobility WOD refers to this as the couch stretch. I'm not sure if he was the one that came up with the name, but awesome, awesome stretch. Essentially what you're going to do here is you're going to put yourself into a position that gets your knee up against the wall. Now, the couch stretch, he's actually got his knee on the cushion and the other part on the back side of the couch. You could use the front end of the couch, you could use a wall, just about anything, a weight bench at the gym, whichever. What you're going to do is you're going to situate your knee back against the wall. So my toe is up, straight up from the floor. I'm going to start in position one. I'm going to lean forward all the while stretching the front of those hip flexors and those quadriceps. As I get into that deep leaning lunge position, I'm really going to hold that for a good minute. When I finish a minute, I'm going to go all the way back, pushing myself back against that front knee. I'm going to hold myself nice and tall, keep that torso nice and tight, and I want to make sure that I start getting a really big, intense stretch through the front of that hip. Those of you that sit all day, this gets completely gummed up. That anterior part of the hip capsule gets very glued. It's very difficult to unglue unless you start foam rolling, start yoga ball, tune-up, and then also too getting that couch stretch. It's a classic one for undoing a lot of that, the ravages really of the sitting. So the other one we're going to do is the grok squat with the external push and the internal rotation. Essentially what you're going to do here is sitting in that grok squat position, you can put your hand down on the floor, you can hold on to a yoga block. As you start to push that outside leg out, you'll notice that I roll my foot over onto the corner, the outside corner. I give a nice push, I stretch the groin, then I internally contract those muscles, touch my knee to the ground, externally rotate, internally rotate, externally rotate. I'm moving that joint capsule through my hip through the fullest range of motion. Same thing on the other side, 8 to 10 per side, just like all of our other stretches. Push, internally rotate, push. Again, I would like to ideally keep myself down in that square position where my other foot is on the ground and staying on the ground. Okay? Classic stretch for just getting those hips moving. Really work out. Again, if you need to sit on a yoga block or a step stool or something of that nature, go for it.